Thank you for your interest in the Salt Lake Valley Health Department. While this is the annual report of the Health Department, we realize achieving a healthy community requires the collective action of many types of professionals coming together to promote and protect health in the Valley. There's no way we can do it alone. Looking back on 2010, I'm quickly reminded of the critical role that public health plays here in Salt Lake County. Whether it's public health nurses who quickly respond to vaccinate the public, or an environmental health scientist who was the first on the scene when oil spilled into Red Butte Creek, we all benefit from the actions of these professionals as they strive to make a healthier community. It's the personal stories of our employees and the families and people we serve who can report Salt Lake Valley Health Department's successes. Please listen along as we tell some of the public health stories of 2010.
Prevention is an important part of public health, but when outbreaks occur anyway, the medical division at Salt Lake Valley Health Department must act quickly. What was a little bit frightening is that we do see Legionella cases occasionally, but all of a sudden we had several cases reported to us. Our big break was making the connection between multiple cases. We discovered that several patients all stayed at a Salt Lake County hotel during the same period of concern. We worked closely with the management of the hotel to find the source of the illness and to inform current guests, as well as any individuals nationwide who may have been guests during the exposure period.
When I first got the call, I was in my office, and it was a very nice August day. The surveillance manager came in, actually in person, and told me we had a hepatitis A case. What was going through my head was, I wonder how much time we have. We did not have any cases linked to this establishment, and I truly believe we prevented an outbreak.
I think the biggest partnership that we made in the first year was with our community and the number of people who came out to volunteer. And I can't say enough about how great these volunteers are, how altruistic they are. A gentleman who's retired, his name is Jim Rose. I have another volunteer, her name is Patience Nelson, who is a mommy of, I believe, 3 children and still finds time as a nurse to come out and help us out.
Salt Lake Valley Health Department's Environmental Health Division is constantly keeping a pulse on new technologies. We're working with businesses, schools, and within our communities to find innovative and proactive remedies in order to promote and protect environmental health here in Salt Lake County.
I mean, the hair on the back of my neck raised up when I saw what was actually going on. I was laying in bed about 7 o'clock having nice dreams. It was Saturday morning. The great thing was we had a huge meeting here where we brought in Salt Lake County Stormwater, and then we brought the other bureaus in, and we really mobilized all of environmental health.
The bill would require that manufacturers, companies that make televisions and computers, take the stuff back and pay to get rid of the proper recycling. But what came out of it that was very positive for the Salt Lake Valley Health Department was that because of our efforts with the legislature, Samsung, which has done this in one other state, came forward and said they would pay for our program.
We can perform the inspection and the data entry simultaneously with the tablet.
The Salt Lake Valley Health Department's Community Health Services Division is committed to keeping Salt Lake County's diverse communities both safe and healthy. When we heard that medical expenditures in Salt Lake County increased nearly 95% in a span of few years, we knew we had work to do. One of our remedies was offering the Healthy Lifestyle Incentive Program to Salt Lake County employees. This program saves the county money, and more importantly, it saves lives.
One participant in the program had a younger brother diagnosed with stage 4 colon cancer. After being told that this cancer could be genetic, she decided it was time to evaluate her lifestyle and get serious about her health. She then set a goal to run a half marathon. So she started with the little things. She'd skip 1 soda a day, take the stairs a couple days a week, walk a few laps around the 3rd floor of the government center. She then set a goal to run a half marathon. Several months before that, she couldn't even think of running or even walking the 13.1 miles and a half marathon.
Dream Center was unique, and when you meet the families that he serves, these are largely immigrants and refugees that live up in the Glendale area, we realized that car seats were the least priority these families needed. They needed basic needs. They needed clothing, they needed food, and then if we could help with making sure when their kids were in a car they were safe, that's the best way we could go about it. We were able to partner with Real Salt Lake. That was important because a lot of these families came from areas where soccer was big, but they could never afford to go to a game. We also were able to partner with Utah Highway Safety Office, which helped us with the car seats that were given out. That's amazing. The need was there. We found the right population and we found the right center.
Healthy community projects are where a group of residents in a city or township come together to address health challenges that exist within their own community. The power of these health-promoting coalitions truly rests in the hands of its resident members. They decide what goals will be addressed, they determine what steps need to be taken and by whom. This is public health at its most grassroots level. Because the community feels a sense of ownership over their projects, we've seen amazing results. Healthy Harriman organized Pedalpalooza, a biking extravaganza comprised of several major events. The Healthy South Jordan Coalition, chaired by Kelly McPherson, wanted to improve the physical fitness of their community. All of these healthy community projects are making a major impact on the health of their residents.
The Family Health Services Division is dedicated to protecting families in our community. We heard from concerned parents all across the valley that worried for the well-being of their children. And when information surfaced that many who died contracted the disease from a parent or a sibling, the fear was even more unsettling. Of those concerned parents was one of our very own, a receptionist at our South Main Clinic. Sadly, she passed pertussis on to her newborn daughter, and I soon realized that our messaging wasn't only pertinent to mothers in Salt Lake County, but to our staff as well. Our strategy started from within, and we made emotional connections with our nurses to prepare them for the long talks ahead with concerned parents. Our nursing staff wore pins and reminded parents to protect their babies by getting vaccinated themselves. Because we feared for our uninsured clients who couldn't afford the pertussis vaccine, we applied for and received funding from AmeriCares. But we didn't stop there. We worked with schools and various community-based organizations to develop strategies that improve immunization rates in Salt Lake County.
We educate them, we empower them, we inspire them with our own stories sometimes, or with other people's stories. And that is the beauty of this program, that over a period of 2.5 years we are able to connect with them. I have a lot of success stories I can boast of, but there's one particular one that I'm really impressed with. She was a client who was not in a really good relationship when I started with her, and it was an accident. She wasn't even sure if she was going to continue with that partner. And so when I got in there, we tried to deal with all these issues at one time. She is graduating next week, and I'm really proud to say that she has already attained self-sufficiency. The baby is really a smart little boy. He's able to talk and run around and play, and she's on her way to having a really good life.
In 2010, the Salt Lake Valley Health Department staff found ways to do more with less. Despite budget cuts, our quality of service remained the same. I'm proud to say no program services were cut. After meeting with the University of Utah and Utah Department of Health, we invited 75 professional partners from all over the valley to discuss their concerns and learn from their experiences. We moved forward with focus groups to survey our diverse communities and to address their environmental and public health worries. This partnership will enable us to work together with our community and develop a long-term community health plan for a healthier Salt Lake County.
It's the stories of county residents, our community partners, and health department employees that really describe the work of the Salt Lake Valley Health Department. We are excited about our work. We are passionate about public health. Thank you for watching and listening to some of those stories.